food could play a big role when it comes to at least lowering thyroid antibodies. It is an important piece of the puzzle. Eating certain foods can result in the immune system attack healthy foods, sometimes can be problematic in other ways. When it comes to healthy categories of foods, sometimes it's not a matter of them being triggers, but being a little bit harsh on the gut and preventing the gut from healing. There's no perfect diet for everyone. It might be too stressful. We don't want someone to start any diet and then feel like they can't follow it. And a lot of it is mental. Food, without question, can be a factor when it comes to thyroid antibodies. Many times we won't see normalization of the thyroid antibodies just by eliminating food alone, but sometimes we'll see dramatic decreases in antibodies and sometimes not. There could be many factors that can cause elevated thyroid antibodies, and in this presentation, I'll be discussing the impact of food triggers. Now, before I begin, I want to mention how eliminating food triggers alone usually won't normalize thyroid antibodies, but they definitely can be an important piece of the puzzle. Also want to let you know that the first couple of minutes I might get a little bit technical, but after that, I think it'll be clear to understand, pretty easy to understand. But let me start off by discussing how can food be a trigger of thyroid autoimmunity. And certain foods, what happens, it can cause an increase in pro-inflammatory cytokines. And as the name suggests, so these promote inflammation, can also cause a decrease in what's called regulatory T cells or Tregs. And there's also something called molecular mimicry. And this is when the peptide sequence of certain foods are similar to those of human molecules. So certain food allergens can result in a decrease in something called oral tolerance. And this triggers an immune system response against various components of food proteins. So in other words, eating certain foods can result in the immune system attacking the food proteins and potentially attacking bodily tissues with a similar amino acid sequence. I mentioned oral tolerance. And so what is oral tolerance? Oral tolerance plays a key role in preventing our immune system from attacking dietary proteins. And then I also mentioned regulatory T cells or Tregs. And these play a big role in preventing our immune system from reacting to food antigens. And so you want to have an abundance of these regulatory T cells. And having a decrease in these regulatory T cells can cause a loss of oral tolerance. And this in turn can set the stage for a leaky gut. And so a leaky gut is part of the triad of autoimmunity. And I've spoken about the triad of autoimmunity in other podcast episodes, videos on my website, naturalendocrinesolutions.com. I have articles, blog posts, my books, thyroid health related books. I discuss the triad of autoimmunity. So according to the triad of autoimmunity, there are 3 factors necessary for autoimmune conditions to develop, including Graves' disease and Hashimoto. So the first component of the triad of autoimmunity is a genetic predisposition. And the good news is just because you have a genetic predisposition doesn't mean that you will develop an autoimmune condition, such as, again, Graves' or Hashimoto's. Second component of the triad of autoimmunity is exposure to one or more environmental triggers. And then third component is an increase in intestinal permeability. Medical term for this is a leaky gut. Now, you might be wondering whether all foods can potentially be triggers of autoimmunity or cause a leaky gut. And the answer is no. I mean, healthy foods sometimes can be problematic in other ways, and I'll talk a little bit about that soon. But there definitely are some foods that are more problematic than others. This includes common allergens. And when talk about common allergens, the 4 main ones that are talked about a lot include gluten, dairy, corn, and soy. Now, soy, a little bit controversial because without question, there are benefits, some really good benefits to eating organic fermented soy. So I wouldn't necessarily categorize soy with these other common allergens. But that being said, I usually do recommend for people to take a break from eating soy when healing. And again, I'll talk a little bit more about soy. But when it comes to healthy categories of foods, sometimes it's not a matter of them being triggers, but either increasing intestinal permeability or maybe not actually causing a leaky gut, but being a little bit harsh on the gut and preventing the gut from healing. So let's discuss some of these foods. Grains. So grains are excluded from both an autoimmune protocol or AIP diet, as well as a standard paleo diet, just like a regular paleo diet. And the reason is because grains can be harsh on the gut. Again, can they actually cause a leaky gut? I mean, certain grains with gluten potentially can, but I would say gluten-free grains probably aren't going to cause a leaky gut, but can potentially prevent the gut from healing. And so I do recommend to take a break from grains while healing. And I mean, it does depend on the person, but we'll talk about autoimmune conditions. So when we talk about Graves, Hashimoto's, I mean, there are some people that might be able to get away with eating some rice or other gluten-free foods. And I should mention some of the gluten-free foods. So rice, gluten-free, but keep in mind that rice, if you just buy regular rice at a health food store or even a regular grocery store, just by itself, it's gluten-free. But if you buy prepackaged rice, or if you go out to eat and you get rice as a side, it might not be gluten-free. Sometimes rice will have wheat in it if you just get like a box of not just plain rice, but again, rice with other ingredients. And similar, if you go out somewhere and you just get a side of rice with whatever else you're eating, you want to make sure that it's gluten-free. Oats are a grain that oats are commonly cross-contaminated with gluten. So if you do eat oats, which again, I'm recommending to take a break from all grains, including oats. But if you were to eat them, you want to make sure that they're certified gluten-free. There's pseudo grains such as quinoa. And again, that's gluten-free. Other grains and pseudo grains, millet, buckwheat, for example. So I would say ideally you want to take a break from all grains, even gluten-free grains, while healing. And what these foods that I'm discussing, the reason is because they include compounds, different compounds like lectins, phytic acid, glycoalkaloids. Again, different foods will have different compounds, which can affect permeability of the gut or, again, prevent someone's gut from healing. So let's talk a little bit about legumes. So legumes are also excluded from not only an AIP diet, but from a standard paleo diet. And soy, I mentioned soy. So soy falls in the legume category. Now, some people would do fine with legumes if properly prepared. So if you soak the legumes or put them in a pressure cooker. And so if someone is a vegan vegetarian, it might really be difficult to follow an AIP diet or even a regular paleo diet. So, I mean, this is a case where I might make an exception and hope that the person heals, even though they're eating legumes. But typically legumes are excluded, like I said, from both an AIP diet as well as a regular paleo diet. Nightshades. So nightshades also excluded from an AIP diet. And nightshades include tomatoes, white potatoes, eggplant, and peppers. And nightshades, they do have some health benefits, but in some people they can cause inflammation. Some people they could affect permeability of the gut. And so again, usually I tell people to take a break from nightshades. So nuts and seeds, a lot of people can tolerate nuts and seeds, but it also depends on the person, depends on what nut they're eating, for example, like almonds and cashews. As much as I love, especially cashews, they can be harsher on the gut. And so when I was dealing with Graves' disease, there was no AIP diet back then. This was 2008 when I was diagnosed with Graves' disease. So I was following just a regular paleo diet. I wasn't eating eggs really because I'm not a big egg person. I'll talk about eggs next, but I was eating nuts and seeds and I hit a roadblock in my recovery. And so I decided to take a break from the nuts and seeds for a couple of months and things got back on track. Now, was it a coincidence? Could be, but for some people, again, I wouldn't consider nuts and seeds a trigger or even causing a leaky gut, but they sometimes can be harsh on the gut. Now, some nuts, like I mentioned, almonds and cashews could be harsher on the gut than other nuts, such as pistachios and macadamia nuts, which are less harsh. And then again, you could prepare nuts in a certain way. You could soak them, you could sprout them. And so ultimately, it's up to you. If you're following a strict AIP diet, then you would be avoiding nuts and seeds. If you're following more of a paleo diet, then that will allow you to eat nuts and seeds. But again, even in that case, you might want to limit the nuts and seeds you eat, not overdo it. And again, maybe just focus on eating certain nuts and seeds. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. So let's talk about eggs. So eggs are included in a paleo diet, but they're excluded from an AIP diet. And eggs they make a great breakfast food and they're a good source of protein, good source of nutrients. The problem with eggs is they are a common allergen. Again, I wouldn't classify them with gluten, dairy, corn, like they don't really fall in the same category of those foods, but they can still consider a common allergen. They're like when someone is following an elimination diet, typically they're told to eliminate eggs. And then there are compounds in the egg whites, which can affect the permeability of the gut. So it's really up to the person. I mean, if someone is really stressed out about following AIP diet and they're following a regular paleo diet, again, they might do fine with the eggs, but if someone's willing to take a break from eggs while healing, I would recommend doing so. I want to shift gears a little bit and talk about iodine, mainly the food sources of iodine, because we're talking about food here. And iodine in some people can be problematic. And I personally had a good experience with iodine many years ago. So I'm definitely not anti-iodine, but eating higher sources of iodine, such as sea vegetables or certain types of seafood, like certain types of shellfish, can be a problem for some people with Graves' and Hashimoto's. So in my book, The Hyperthyroid Healing Diet, I talk about iodine in food. I actually talk about iodine, I think really in all three of my books. And Hashimoto's triggers, I talk about iodine being a concern in natural treatment solutions for hyperthyroidism and Graves' disease, which is now in its third edition as a recording this. So I talk about it, but I get into the greatest detail in my book, The Hyperthyroid Healing Diet, and there's a separate bonus chapter on food sources of iodine. And like I said, it does with a lot of these things. It depends on the person. Some people might be able to get away with eating sea vegetables and or shellfish, but I would just be careful not to overdo it because iodine can be problematic in some people. And as far as how much iodine should you consume, I mean, some will suggest 200 micrograms or less of iodine per day when it comes to food, and if any is in a supplement you're taking, like a multivitamin. I mean, I find that a lot of people can consume more iodine than that, like 300, 400, 500 micrograms, but it does depend on the person. I mean, the milligram doses of iodine, usually you're not going to get that from eating food. Maybe if you're eating kelp, but most of the time, if you're eating other food sources, you're probably not going to get really high with the iodine as far as like exceeding 500 micrograms and getting into the milligram dose. It's usually with the supplementation that causes that. But yeah, just be aware that food sources of iodine, again, can be a problem. I wouldn't say necessarily that they would be a trigger. I mean, potentially they can be. They may be exacerbating in some people the autoimmune response, but not really causing, not being like one of the main triggers of Graves' or Hashimoto's. And if someone is taking high dose supplementation, that's a little bit of a different story. So let's now talk about how to detect food triggers. So two of the main ways is through an elimination diet, or there's also food sensitivity testing, and there's benefits and limitations of each. So benefits of an elimination diet, which is what I typically recommend to my autoimmune thyroid patients. The benefit is that there's no cost, whereas when doing food sensitivity testing, it can get expensive. So elimination diet, like AIP, the autoimmune protocol, is a type of elimination diet. The downside, the limitations, is that you might react to some healthy foods. Again, not to say that something like broccoli or avocados will be a trigger, like trigger Graves' or Hashimoto's, but some people might be sensitive to them, and as a result, might cause inflammation. And if you do a food sensitivity test, it might pick it up. So that's a benefit of the food sensitivity test. One of the limitations is not all of them are reproducible, which is not a good thing if you spend money on a test. And let's say, not that most people wouldn't do this, but if you took two blood samples at the same time and sent them to the same lab doing a food sensitivity test and then put two separate names, and if they came back with different results, again, that wouldn't be a good thing because then the test is not valid at all. And so that's a concern with some food sensitivity testing, especially like IgG food sensitivity testing. If someone does a food sensitivity test and it has a lot of findings, and also usually it's a leaky gut. So if they're showing, let's say, a few dozen foods, including healthy ones like broccoli, lettuce, avocado, asparagus, all these healthy foods, eliminating the food might not be the problem. It might be a matter of just healing the gut, which is easier said than done. And again, I have episodes on my podcast where I talk about healing the gut. I talk about it in my 3 thyroid related books, and I have blog posts and articles where I talk about that. But that's also something to keep in mind. And then another limitation depends on the food sensitivity test, but with IgG food sensitivity testing, you need to be eating the food in order for it to test positive. So if you're avoiding certain foods, then you wouldn't expect those foods to come back positive. Now, in some cases, a person will, which means they're either getting exposed to that food and they don't know it, or again, we got to question the accuracy of the test. So I like an elimination diet. I'm not saying there's not a time and place for food sensitivity testing. If someone is hitting a roadblock, let's say, that might be a time when you might want to consider food sensitivity testing to see if it shows if they're reacting to something. And maybe if they only react to like 3, 4, 5 foods, they could easily eliminate those foods. But again, if they're showing 20 foods, 30 foods that they're reacting to, then the solution might not be eliminating those foods, but really focusing on gut healing. Now, when following elimination diet, you want to eventually reintroduce foods. So if someone's following, for example, an AIP diet, autoimmune protocol, I would recommend following it for at least 30 days and ideally 90 days. And then regardless of whether it's 30 days, 60 days, 90 days, or some people might even follow it a little bit longer, you want to reintroduce foods slowly, one at a time, every 3 to 4 days, because if you reintroduce multiple foods at the same time and if you have any type of reaction, then you wouldn't know which of those foods is causing a reaction. And sometimes it could be challenging to know if you're getting a symptom because of a specific food. So an example I commonly give is, let's say someone has eliminated eggs, and then after, let's say, 3 months, they reintroduce eggs, and then they get headaches. Is it possible that the headaches is just due to a stressful day and not the eggs? It is possible. So in that case, you might want to just document that you get in the headaches, and then take a break from the eggs for another few weeks, and then assuming the headaches subside, reintroduce the eggs again. If you get the same symptom, then it probably is a sensitivity to the food, and then you might want to eliminate that food for another 3 to 6 months. You might have to do it even longer than that, but at least minimum 3 to 6 months. And so, yeah, reintroducing foods. Again, I talk about this in my books. I talk about this. I have podcast episodes. A lot of the stuff I'm talking about here, I have podcast episodes, articles in my book. So if you want more information, definitely recommend checking out those resources. So let's talk about diet more, because you might be wondering, is there a certain diet that you should follow? Like I spoke about AIP. So should you follow AIP, or is it okay just to follow a regular paleo diet? Or in some cases I mentioned, maybe even like vegan vegetarians, where they could be a little bit more flexible and follow what's called a plant paradox diet, which is by Dr. Stephen Gundry. So I do recommend for most people who have Graves or Hashimoto's or the antibodies to both of these to follow an AIP diet. But there's no perfect diet for everyone. So some people might not be ready to follow AIP. It might be too stressful. Maybe they're eating fast food on a regular basis and a lot of refined foods and sugars. And really the goal should be just to take a break from gluten and introduce some whole healthy foods, because we want to set them up for success. We don't want someone to start any diet and then feel like they can't follow it. And a lot of it is mental, but still, whatever the reason, if someone is unable to follow it, and then they go back to their old habits, we don't want that to happen. So yes, if someone has Graves or Hashimoto's, AIP is great. And a lot of people find it restricted because they're not eating enough protein. They're not eating enough variety. So AIP, not to say it's easy, but you just want to make sure you're eating enough, especially getting enough protein. And so AIP, paleo would be like if someone's not willing to follow AIP, I would say paleo would be the next thing. Plant paradox if someone is vegan, vegetarian. Again, I talk about more about these in the different areas, podcasts, my books, my articles and blog posts. And then I want to kind of wrap up this presentation by talk about fasting. So some have asked me over the years whether intermittent fasting can play a role in lowering thyroid antibodies. And I do like intermittent fasting. I actually incorporate intermittent fasting on a wellness basis. Now, when I was dealing with Graves' disease, I wouldn't have wanted to incorporate intermittent fasting because I was losing a lot of weight. My adrenals weren't in good shape. And so those are some of the things we look at. We want to look at if someone doesn't have healthy adrenals, if someone does have hyperthyroidism and they're losing a lot of weight, then they might not be a good fit for intermittent fasting. Maybe in the future they can incorporate it, but it's not, intermittent fasting isn't for everyone. And then, well, first of all, I will say that most people, they would be okay doing like 12 to 14 hours. So 12 hours, I think most people should do. There are some exceptions, but 16-8 is a common intermittent fasting routine. And again, that depends on the person. Some people will go beyond that, like 18-6 or 20 hours per day fasting. And I think this could get extreme if you're doing it on a daily basis, because the problem is that if you have such a small eating window, you might not get enough nutrients. And then also you might not get enough protein. So I like fasting. I actually interviewed a few experts on the podcast, Cynthia Thurlow, Dr. David Jockers, so you could check out their episodes. And so I'm definitely not against fasting, but I would be cautious. And so that's pretty much all I want to discuss, as food without question can be a factor when it comes to thyroid antibodies. And sometimes people could have dramatic results when eliminating certain foods. So many times we won't see normalization of the thyroid antibodies just by eliminating food alone, but sometimes we'll see dramatic decreases in antibodies and sometimes not. And if not, that means that there are other factors. So don't get discouraged if you make dietary changes and you don't see changes in your antibodies. Again, that's why there are other factors. Stress, there are infections, environmental toxins could also be a factor. So before wrapping up this video, I want to ask you this question. Have you eliminated any of the food triggers I mentioned? And if so, did you notice any improvements in your health? Please let me know in the comments below. And if you want to learn more about how to save your thyroid and regain your health, then I highly recommend to watch one of my free webinars on thyroid health. And I'll make sure to include a link in the description below this video. Thank you so much for watching this. Give this video a like if you learned something new, and consider subscribing if you want to learn more about how to save your thyroid.